Hello, I'm Kristen Bandy with Arkansas Children's, and I am joined by Dr. Lauren Poindexter here at Arkansas Children's Northwest. Dr. Poindexter is a sports medicine physician here at the Arkansas Children's Northwest location. Welcome. Thank you for joining us today.
Thank you so much, Kristen, for having me.
Now, tell me a little bit about what you do here.
So I am a non-surgical sports medicine physician, meaning that oftentimes I'm the first person to see in our outpatient clinics any of the children who have musculoskeletal injuries from sports or even concussions.
And how long have you been doing that?
I've been in my position for a little over a year, but I've been involved in sports medicine in one way or another for going on 23 years now.
Wow. And what drew you to sports medicine?
When I was a child, I had a number of injuries that I really struggled with because I wasn't able to get a great diagnosis or have the type of therapy that I really wanted. And I remember thinking to myself, I don't want anybody else to have to go through this type of experience without having a team of helpers around.
So you said you had a lot of sports injuries as a kid. Can you tell me about some of them and how it's affected the way you treat the children that you see?
Sure. Well, my first injury that I can remember was in first grade. I was kicked in the arm accidentally during recess and I actually broke my arm. But the secretary at school told me it was just a bone bruise and it would hurt, so I just didn't complain for 2 weeks. When I had trouble lifting a tennis racket, we finally went to the doctor and the doctor was shocked that I had gone for 2 weeks with a broken arm. So at that point, she put me in a splint and I immediately asked, but I can still do gymnastics, right? I can just do it with my good hand.
Well, you lived for 2 weeks with a broken arm.
I did. It was
Sounds
shocking.
like you were doing okay, right?
Everyone was really surprised.
Was it your non-dominant hand?
I believe it was actually my dominant hand.
That makes it even better.
But we had a gymnastics showcase that I really wanted to participate in. And thankfully, they just put me in a splint so I could still write. It just took a long time to get my papers done.
Well, I don't know how you can top that one, but tell me how that experience has affected how you deal with your patients.
Absolutely. So kids and adults of all ages have varying pain thresholds, which means that some devastating injuries affect kids and affect adults totally differently. And so being someone who had an arm fracture and didn't whine about it, you know, I have kids who will have similar situations and we want to treat them with the utmost care regardless of how impactful their pain is.
So a lot of times with kids, you can only go by what they're telling you. What do you do when you have a kid like you who just suffers through it and doesn't feel the pain?
Yep, absolutely. So in that case, we have a significant conversation with the parents because obviously the parents know the kid the best. And we also try to do a really thorough physical examination with every child. We also are fairly conservative with our x-rays. So if given the mechanism of injury or how the accident occurred, we will want to get x-rays just to make sure that things look okay.
Tell me about your typical day as a sports med physician.
One of the fun things about my job is that there is no typical day. I'm here at Arkansas Children's Northwest on Tuesdays and Fridays, but I also work at UAMS and I'm also a team physician for the Razorbacks.
Oh.
So I am all over the region and I actually love it that way.
So you see the full spectrum of injuries from children all the way up to adults.
Yep. We joke that I'll see anyone between the ages of 4 and 94.
Well,
outside that.
Do your friends call you to see their dogs or cats? Like you've seen so many bones.
All the time.
Like just
all
this
the time.
is a different. It's just a
Yes.
same bone. Like it's fine.
Yes.
So-
Yes.
Okay, so what are some of the most common injuries that you treat in children?
So it's perfect timing that you asked this question because we're in football and soccer season right now. So we are getting a lot of sprained ankles and knee injuries and concussions as well.
Now, what do you say to a parent like me who is a little bit scared of sports because of these injuries? I mean, is there anything that you can do to prevent it, or do you just have to trust that you'll see the right doctor when it comes down to it?
Absolutely. And I hope that I am the right doctor for those injuries. But, you know, the risk of injury in sports differs from sport to sport, right? So the incidence of concussion in bowling, much different than the incidence of concussion in football or in soccer. But one of the things that we recognize about children participating in sports is it gives them such a wonderful sense of accomplishment, and also the teamwork that they learn about and the camaraderie is so necessary to helping them weather the storms that come with just being a regular kid. And injuries can be a difficult time, especially really stressful for parents who may be afraid to let their child go back to the playing field after an injury. And we talk about those emotions. We invite parents and we invite kids to talk about what that injury means to them, because that's a safe place for us to learn about our bodies and also for us to explore that emotional side of injuries.
That's great. So while we're talking about parental tips, how could a parent help a child that may have a very high pain tolerance? What are we looking for when we think our child, surely that fall resulted in a broken bone, but she seems fine? What can we do? I mean, besides just take them straight to the ER.
Yep.
Is there anything to
Absolutely.
keep an eye out for?
Well, there's never, there's never a wrong decision to err on the side of caution. And we have fantastic emergency medicine physicians here at ACNW who will refer patients to our sports medicine clinic if, for example, the child does have pain, but there's no obvious fracture. Sometimes with kids who are not used to the pain of injuries, sometimes they'll have a very dramatic response to injury. And in that situation, oftentimes a good night's sleep, an ice pack, and maybe even some Tylenol or Advil can be really helpful. If the pain continues to the next day, or they have trouble playing with their friends, doing normal activities, just like walking around the house or doing their chores, in that situation, we're always just a phone call away.
You're one of the only You are the only female sports medicine physician in this region. What is that like for you to have that unique position?
I actually didn't recognize this till just a couple months ago, and it is a unique position to be in. This year marks the 50th anniversary of Title IX, and what we have recognized over these past couple decades is that female student athletes, whether they're girls, whether they're adult women, really want to have the option of seeing a sports medicine physician of their own gender, and being able to offer the local kids and the local adults that, I think is really special, and they've actually voiced their appreciation in person.
You've been doing this for 23 years. What have you seen change in the field?
There's been an explosion of women and young girls entering sports. We've also seen recently how these female athletes have found more courage and more self-confidence in saying out loud, I'm hurt, I don't feel comfortable proceeding. And we are expected and happy to respect those opinions. And the prevailing outlook among sports medicine providers at this time is to show compassion, is to understand the emotional aspect of injuries and recognize that it's important to walk with these young women through their injury process and understand how it's going to be affecting them emotionally.
I know a lot of us that grew up in the 80s,
Yes.
even the early 90s. We were in the, rub some dirt on it, walk it off, you're not that hurt, I'll give you something to cry about even. So that seems to be changing in this generation, and it seems to be led by the doctors making a conscious choice to listen when a kid says they're hurt. I love that, and as someone who got told a lot, oh, that can't hurt that bad, I had a very low pain tolerance. Sometimes it does hurt that bad, and I love to hear that you guys are actively listening to that now.
Absolutely. There's been an entire culture shift that includes sports medicine physicians, but also parents and coaches and school administrators and even the kids themselves. We recognize that as fun as sports is and as high as the stakes can be sometimes, that health is our number one asset. And if there is even the suggestion of an injury or an illness, it's important to respect that process. the students and the kids that I see in clinic, we will take time to talk about what it means to respect your injury, to invest in the recovery process, and during that, to still show up at practices and still show up at games. But they're serving as a role model for their friends as to how to take these injuries seriously and how to best recover in a timely manner so that they can get back to their sport and be as healthy as possible.
Love that. You're doing more than just fixing their injury. You're doing a whole lot more, aren't you?
Absolutely.
I love that. Tell me, what is your favorite thing about your job?
Oh my gosh. Well, it has to be said, nobody comes to the hospital because they want to. Being in pain and having an injury is not on anyone's top 10 list of things to do. And one of the things I love is when the kids come in and they're upset or the parents are upset, calming them down, finding a joke if we can, but really teaching them that their body isn't something to be afraid of. The injury is not something to be afraid of. This is going to be a temporary process, and that reassurance goes a really long way.
I love it. I can tell you're incredibly passionate about what you do. It pours out of you. So thank you, Dr. Poindexter, for sitting down with us today. Thank you all for joining us, and we will link in the comments where you can find out more about the sports medicine department at ACNW.